Welcome to our prevention presentation. I'm Amy Scott.
I'm Joy Browning.
I'm Kelsey Wilson.
And I'm Margaret Robbins.
Did you know that the first 3 years of your child's life, when the brain is developing and maturing, is the most intensive period for acquiring speech and language skills? These skills develop best in a world rich with sounds, sights, and a consistent exposure to the speech and language of other people. There are critical periods for speech and language development in infants and young children when the brain is best able to absorb language. If these critical periods are allowed to pass without exposure to language, it will be more difficult to learn. How does speech and language develop? Language learning is not a passive process. Newborn infants have been hearing language for close to 4 months before their birth. The ability to hear language plays a major role in language development. Infants can be taught to tell the difference between speech sounds. Research suggests a positive relationship between early infant vocalizations and later developing adult-like speech. Babbling and baby talk are the sounds of infants and toddlers modeling what they have heard from us. A child's brain is learning and changing more during language acquisition in the first 6 years of life than during any other cognitive ability he's working to acquire, according to Dr. Bruce Perry.
Here are some developmental milestones you may see in your child. At 0 to 8 months, they're in the pre-linguistic stage before they start speaking. Your child will make vegetative sounds. They might coo and laugh. They'll have vocal play, and you'll hear them babbling. At 8 to 12 months, your child will start gesturing and vocalizing more. They will use their first words to request objects, to refuse objects, to comment on them, and they will understand 3 to 50 words. At 12 to 18 months, your child's intentions are expressed similarly to before, but with meaning. Their expressive vocabulary is at 50 to 100 words, and roles are expressed in one-word speech, such as mine and go. Their first 50 words are based on their favored and avoided sounds. At 18 to 24 months, you might see a frequency of word use increasing, as well as new intentions from your child, as they request more information, as they answer questions, and you will see that their average vocabulary is at 200 to 300 words by 2 years old, and their speech should be 50% intelligible or understood to an unfamiliar listener. At 24 to 30 months, your child may start repeating topics as well as showing new intentions. They might use please for polite request. You will see symbolic play in their activities. Their storytelling narratives will emerge, full of labels and descriptions, and you will see them understand what, who, what so-and-so is doing, and where so-and-so is going. They will also develop an awareness of rhyme, and you will see them use ing, plural s, and in and on. They might also begin misrepresenting reality in the form of teasing or fibbing. At 30 to 36 months, topical talk will continue with new information. They'll also start requesting clarification. Their use of language and play will increase. Their storytelling narratives will have a theme, but not a plot. The use and understanding of why questions will emerge. You will see them overgeneralize the use of past tense, and their speech should be 75% intelligible or understood at 36 months. At 36 to 42 months, your child may show more flexibility in requesting and more indirect request. Their storytelling narratives are primitive with a theme. Your child may understand basic color words, basic family terms. Relations between conjoined sentences emerge in their first complex sentences, and the articles a, an, and the are acquired, as well as possessive s. At 42 to 48 months, new functions emerge, including reasoning, predicting, reporting on the past, expressing empathy for others, creating imaginary roles, and maintaining interactions. Your child may also use and understand when and how questions. They will understand basic shape words, basic vocabulary words, and they will use conjunctions such as and because. At 48 to 60 months, your child's knowledge of letter names and sounds emerges. Their knowledge of numbers and counting emerges. Their use of conjunctions will include when, so, and because, and their basic sentence forms are acquired. They should be able to start finding syllables and words, and their speech should be 100% intelligible to an unfamiliar listener.
There are several things for you to consider that could place your child at a potential risk for developing language problems. Here are some of them. If your child is male, they typically develop at a slower rate than females. If your child has had a history of reoccurring or untreated ear infections, they could possibly have a conductive hearing loss that can seriously affect their exposure to spoken language and their own later speech and language development. If you or another one of your children have a family history of speech or language difficulties, it can definitely impact your child's development. If your child has an apparent speech defect or another disorder such as autism or dyslexia, or a physical abnormality such as cleft palate, their language can be affected as well. If your child was a late talker or babbler, they can also have a language problem. They need to be having their first words at 12 months. If language is a second language in your home, then your child could potentially code switch, which means that they mix the two languages. If you do not read to your child, they could also have delayed reading skills or poor performance in school in the future. Reading is a fun way that you can connect to your child and also help them build their speech skills, their literacy skills, and their awareness of print. Here are some things that you can look for to determine if your child's language is normal. At ages 2 to 3, they should understand the differences in meanings. They should be able to follow multiple requests. They should also enjoy listening to stories and use 2 or 3 words to talk about or ask for things. They should understand speech and name objects when asking for them. And of course, this is the stage when they ask the why questions. At ages 3 to 4, your child should hear television or radio at the same loudness level as others. They should also understand words for family, colors, and shapes. Your child at this stage should talk about their day, things at home or preschool, or things at their friend's home. They should ask why, when, and how questions and answer simple questions. They should use pronouns such as he, she, and them, and also plurals. And they should talk easily without repeating syllables or words.
Here are ways to enhance healthy language development in your child. Use simple speech that's clear and easy to imitate. Be a good speech model when talking to them. Have fun playing with sounds, like when reading a book. Make the sound of the animal. Give them attention when they're speaking. Help them to know that they're important and what they have to say is important. Expand on what they say. If they say pretty flower, you can say, yes, that's a pretty flower. The flower's bright red. You can also read stories, like at bedtime, counting toes, fingers, and steps, name and describe objects, and also ask questions that require them to answer other than yes or no. Don't give them just a yes or no question. An example of this would be like, do you want milk or water? And they would answer milk or water. You can also use pictures and categories. This means give them a picture and ask them what doesn't belong in this picture. Help your child retell a story and act it out, like role play. You can also introduce nursery rhymes so they learn how to rhyme. You can encourage good form by repeating the correct use of words so your child can compare his production to your production.
Work on vocabulary in everyday activities such as when they're in the bath, at mealtime, and playtime to make good connections between words and how we use them in everyday life. Listen, talk, read, and play. These are key things that you should do with your child. Communicating in the language you're most comfortable using. Speaking in a second language is very good for your child to learn, especially at a young age. Use longer sentences as your child gets older so they understand to use this in their speech. Talk about what you're going to do and what your child is doing throughout the day. Like when you're putting on their clothes, say, we put on our red shirt today. Have play dates with other children so they can learn to communicate and share. Remember to be an active communicator with your child. Talk with them and to them rather than just talking at them. Also, lastly, encourage good use of playtime. Learn to play and play to learn. Finally, take action. Early intervention is so important. There's always free or low-cost public services for infants and toddlers if you think your child has a language disorder. If you notice any warning signs in your child, please contact a speech therapist in your area, local school, or go to www.asha.org. And these are a list of our references. Thank you.